My icons keep jumping all over the place. Okay. Okay, good to go. All righty, good morning and welcome to the medication chart training today. Now, I just want to do the Ghana acknowledgement. We express our gratitude to the Ghana peoples for their continuous care of this ancient country for thousands of generations and for the sharing of this land that was never ceded. We recognise and respect the wisdom of Ghana elders, past, present, and those to come, and extend this to all First Nations people and their living cultures. We walk softly alongside First Nations people as allies committed to seeking guidance, listening with purpose, and acting with courage in our future together. Always was, always will be. Now, welcome and good morning. Hi. So those of you who are new to the building, the toilets are through the kitchen and down past the lifts on the left. The stairs are, you need to go down the stairs and down the second flight of stairs in the case of we need to evacuate. And then the first floor stairs are through the IT department at the very end of the building, and we congregate in the car park. Hopefully that won't be happening. So I've provided some masks here for you, should you require them, if you feel you need them. And also I've arranged the seating so that we have safe distance between us. Please feel free to ask any questions throughout the training, and remember that anything we discuss regarding customers or personal issues remain confidential and stay within this room. So I'm Alex Reynolds and I am the Disability Support Lead for Anglicare SA. So I'm basically here to help you guys with any clinical issues you have with your customers. Okay. So any support you feel you need, please reach out. Please help yourself to some lollies if you can reach them. Keep them away from Sim. No. And if you feel you need to get up and stretch or anything like that, please do so. So today we're basically going to go through the disability medication chart. Have you all been using it?
Yeah.
Yes. Okay, beautiful. So this should be really quite quick. But one of the reasons we're going through it is also so that you guys can help prompt the GP. Okay, so do you just want to say your first names and just tell me where you're working?
My name is Mandeep. I'm working
Okay, beautiful. Yeah.
My name is Hardeep. I'm working in Brampton.
Excellent.
Harpreet, I'm working at Faglon.
Yep, beautiful. And Sim. Excellent. Thank you. That was just for the purpose. So I did share that I am recording this for I'm doing a Cert 4 in training and assessment. So if that's okay, you're not on film though, so it's just me. So is that okay that I'm recording the session? Beautiful. Perfect. Okay, so let's get into it. Today we're going to basically go through the medication chart, which is a 6-month, this isn't working. It's a 6-month chart, and we'll be basically going through from the front page. What I'm trying to do today is empower you guys to take control of this medication chart. Okay, we'll be so that you'll be in a position to read and interpret it. We'll go through the 7 R's of safe medication administration, medication counts, receiving and removing meds, actual administration, the correct PRN procedures and steps with what to do if there are any errors, infection control, and scope of practice. So on the front page, that's just what I've said. On our front page, we have the client's details. So I know that Anglicare SA have had probably a bit of a blames culture in the past. We're absolutely the opposite of that now. And that is why I'm empowering you guys to actually complete the front page of this medication chart. Alrighty. So we need to neatly fill in the customer details in the provided field. And please remember to put the chart start date on the front page just here. And the informed consent, every time you give a medication, you ask the customer if they're happy to have their medication. So that is consent. Consent doesn't have to be just written down and signed. Okay. And also when our customers swapped over to Chemist King, all of them signed a consent. Okay, so feel confident to sign that, tick the box and date that the customer has given consent. Now, the photo ID must be updated every 12 months because if our customers have had an illness or they've lost a lot of weight, their facial images can change. So we need to make sure that a photo is updated every 12 months and dated appropriately. Now, I'll just hand out some medication charts so you can have a look at them. So pass them around for me. Thank you. And one for Sim. Excellent. So also, we always use the photo ID to identify our customers. So we must have a current one. So continuing on to the front page, you'll see we have the allergies section. Now, the allergies are listed on just about every documentation we get from the medical practitioner. So, like the GP care plans have it on, the medication lists have it on. So please just sign. So you can either tick, if they have no known allergies, we would tick the no known drug alert box and sign and date. Okay. If they do have an allergy, we write what the allergy is, what the reaction is, and still sign and date that we've updated the allergies. Okay. We would also stick one of these little drug alert stickers in this alert label little box here. And there is also one on the short-term medication page as well. So that's just to alert us to the fact that we have to be careful and check and double check because they have an allergy. Then we would fill in the details, so GP and specialist details, the pharmacy details, and in the provider contact details, I'm wanting the practice leader and their name and mobile number. Then right at the end, we have the vaccination status. Now, this is very important just to make sure that our customers are up to date. So what I suggest with this is you get a printout of the vaccination certificate from the GP and then just transcribe it in. When you're doing the COVID vaccinations, just put their first and second dose and then their latest dose. Okay, because some people are now up to the 7th and 8th dose of COVID vaccination because over the age of 80, they're suggesting it every 6 months. So, okay. So moving on, now this is where my empowerment is happening. So how many times would your GP have given your customers medication?
You mean the administration?
Yes, how many times would your GP have administered a medication to your customers? Never. How many times have you administered medication to your customers?
It's depend on the medication chart, like if they have a morning and afternoon.
Yeah.
So we are
But
administer according to that, yeah.
lots of times. So you know better than the GP how your customer has their medication. So this is for you to fill out, okay?
Yeah.
Because you know whether they have it whole, whether they have it crushed, whether they have it in custard, you know, all those sorts of things. So this is where we get you to fill it out. And then all we need you to do is date it, write your name, sign your name, and then the designation means your position. So support worker, or if Sim, you're filling it out, practice leader. Okay, so it's not this big scary thing that somebody's going to tell you off for signing. Okay, I promise. Okay, now further on, we have the additional care plans. So just add in any other care plans that the customer might have, dysphagia management plans or behaviour support plans, anything like that. And, oh, sorry, I jumped and went to the vaccinations a bit earlier. I think my PowerPoint was incorrect then. Anyway, we'll move right along. Okay, so on to medication counts. So this is going to save you guys time. Our medication counts, we are only doing once a day, and we are only doing some certain PRN medications. So you don't have to count every PRN every shift anymore. So as you can see on this medication chart, on the 12th of January, there are 5 midazolam's in stock.
Yeah.
And on the 13th, we only have 3. What do we do? Because we've now got, according to this, we've now got 2 vials of midazolam that are missing. So what would we do to find out where they've gone?
Check it administered.
Absolutely. Perfect. Good job. So we check the PRN medication chart and they haven't received a dose of midazolam. So they obviously, the customer hasn't had a seizure. They haven't received the midazolam. What do we do now? We've got 2 missing vials of midazolam.
Report about it.
Yes, report to Sim, your practice leader or on-call officer. What else would we do? Complete a risk man incident report. Yep.
It is going to poisons as well. I don't know, but just asking.
No need for that. But we would start a bit of an investigation. We would try and backtrack and work out where the midazolam could be. So
Options.
perfect. It could have been left at day options. It could have been left in the van or the car. Or, Harpreet, you might be having a party on the weekend and you might want to have a bit of fun with some, party drugs.
Yeah.
Don't do that because then you won't work for us anymore. But anyway, these medications turned up at day options, so that's all fine. Everything was fine. The incident report was completed. But it gives you an example of why we need to be accountable for these medications. Okay, so the sorts of medications we're going to be looking at are Schedule 8 drugs, are substances that are potentially dangerous, may be abused, and are addiction producing or potentially addiction producing. Okay, so they're your really heavy drugs. Your Schedule 4 drugs are prescription-only drugs that are subject to special controls because they have a potential for abuse or misuse. And we're going to label these as controlled drugs for our presentation today. So examples of S8 drugs are in the opioid group, you've got buprenorphine, which is your Norspan patch, fentanyl, hydromorphone, methadone, morphine, oxycodone, pethidine, and pentadol. Your benzodiazepams, there's alprazolam and flunitrazepam. And your other drugs are medicinal cannabis, stimulants like dexamphetamine and codeine. And that's codeine just on its own, not mixed. Sure.
Except pharmacy.
Mhm,
So we had,
mhm.
so I'm assuming it's completely.
Yeah, so that's she's smoking that. Yeah. Yeah, that's fine. I'll double check, but I'm pretty sure we don't have to.
But we have nothing.
Yeah.
The orders.
There's no possible way we could control that.
Yeah.
So that's fine. As long as it's stored safely, that would.
Self-storage, so she's got her own locker.
Okay,
She
great.
stores it.
That's
We
fabulous.
have no control of it.
Yeah, because that
Yeah.
would be our main risk is if it's in a somewhere that is accessible. Yeah. Yeah. Yeah, sure. No, that's fine. All good. Thank you for that. Now, your S4 PRN or controlled drugs that are to be counted include in the benzo group the clonazepam, diazepam, lorazepam, midazolam, clobazam, and clonazepam. So all your AMs and PAMs. Codeine containing medication like your paracetamol and codeine, like I'm sure you've all heard of Panadine Forte, and ibuprofen and codeine. And the other groups, there's gabapentin, pregabalin, quetiapine, and tramadol. Now, some of our customers are ordered quetiapine on a regular basis. We're not counting that. We are just counting the PRNs. Okay. So we'll be saving time. So moving on to the medicines received and removed register, we have, so this is where we are going to be recording whenever we receive anything from pharmacy and whenever we send anything back to pharmacy. Okay, so the whole purpose of this medication chart is that everything is all in one place. So when we have audits and things like that, it's all here. We don't have to search through files and go mad trying to find things. Okay, so so it's basically just a log to record when we get something in and when we send something out. So all we need to do with the medicines received register is put the date in, whether it's pharmacy sachets or, sorry, my brand new drink bottle chirps at me. It makes sounds and it's so off-putting. So are all the medicines correct? Now, we had a bit of resistance with this initially because people weren't confident to say yes or no. All we expect of you is to check that we've got the correct number of medications that should be in the sachets and according to the medication chart. So just do a quick check through and make sure there are 2 blue, 1 white every morning, that sort of thing. We're not expecting you to be able to identify every tablet and go through at a pharmacist level because we're not pharmacists. All right. So it's, yeah, and then are the non-packed medicines in date? So we would only use that if we're getting inhalers in or creams, something like that. Otherwise, just put NA alongside that. And are the medicines noticeably in good condition? So we don't want to have like tears in the medication sachets or, boxes of medicine that are ripped or, damaged. So when we're entering any S8 medications, we need to put them on a separate line. And and then down the bottom here, we have a section, and it's missing the heading, but the section is for a GP review. So if the GP reviews the medication chart, just get them to sign and date that they've reviewed the medication chart. Okay, and same with the pharmacist on the right-hand side. If the customer has an HMR or the pharmacist reviews the medication chart, just get them to date and sign it. So it's just a record that we've had the medication reviewed. All right. So on the next page, we have our sample staff signatures. Now, this has been done for in the nursing world for years and years and years. It's basically so that we can identify at a quick glance who has given that medication. So all we need to do is clearly write your name, sign it, and then initial it. Okay, and it just gives us a bit of clarity as to, we can just look at the medication chart and go, oh yeah, I'll just chat to Harpreet and see if that medication was effective. Okay, easy peasy. Okay, so moving on to medication orders. They are color-coded, so your short-term medication order page is red, your PRN is green, and your regular orders are blue. Now, it is very important to witness your staff. It is important for you guys to witness the customer taking the medication, because your signature on this chart means that the customer has taken their medication. Okay. So we also need to document if a customer has refused medication or if they're in hospital, if they're fasting. And on the back of the medication chart, you'll see cheat sheets. So there's dose admitted codes on the back of the chart. So if a customer was on leave, you just put an L. If they refused, you would put an R. And what would we do if a customer refused their medication?
Do the resume or
Yep, perfect. But we'd probably try again in a 10 minutes time, see if they, yeah, I'd try 3 times, separated by about 10 minutes. And then on the last time, ask the customer why they don't want their medication, because it might be making them feel sick, or it might not be doing what it's meant to be doing. And we've never actually sat and questioned and, asked them. Okay. And then put an R in where you would normally initial, just put an R. Very good. And of course, as you said, any discrepancies or incidents relating to medications must be recorded on an riskman incident report and reported to your practice leader. Beautiful. Okay, so also don't use the medication chart for longer than 6 months, generally. So, so I've actually seen nurses trying to add columns in on this last page and draw lines down so they can keep signing.
after that we share.
So this is this yellow bit here on the chart is reminding us to go and get a new chart completed, which is what the stage we're at the moment. So we've had these up and running for 6 months, almost. Yeah. Okay, so the next page is our short-term or antibiotic page. Now, you'll see that there are only 14 boxes to sign on this page. Okay, so these are only for short-term medications like an antibiotic, maybe prednisolone, and so you would get the doctor to write the medication, and see this highlighted bit here, the indication. Please prompt him to also write why he's ordering the medication. So this is like a purpose of medication form, because then you can look at this and know that your customer may be on amoxil and have some prednisolone ordered, they've got a chest infection, and you can tell that just from this. And then obviously you'll know to keep a check on their breathing and coughing and all those sorts of things. Okay. And the GP should be writing the start date and the finish date so that we know exactly when to start and stop the medication. Okay. So please make sure they also don't use it for PRN medication or regular medication, because what happens when that happens, we'll be going back the next day and we'll be going back the next day and asking them to do it again. And we have had that happen. Okay. So that's our short-term medication page. Now, the PRN orders. Now, this is a very important page. We were actually audited when I first started here, and there were signatures, and the PRNs were so untidy that we couldn't read the quantity that was given, the time they were given, or the date that it was given. And if we have issues, I don't want to be standing up in court saying, oh, I'm sorry, I can't read my support worker's writing. I have no idea when this was given. Okay. So in saying that, what I've actually done on most of the charts is, and I'm happy for you to do this box you can cross out, just a diagonal cross, because the holes on this side of the page are a lot smaller than on this side of the page. Okay. The other thing with this chart is we're signing from left to right. So your first dose will be there, then your second dose will be there. So we're working across the page with the doses, which also makes it neater because we're not putting them on top of each other and they're all getting jumbled and messed up. Okay, so does that make sense? So we'll just see if I make, this box is really in the way. Anyway, so legibility is the biggest issue with the PRN chart. We need to chart the date, the time, the quantity, and initial what we've given. Okay. Also check that it's not prescribed as a regular order because we don't want to double dose customers. And anything other than Panadol or over-the-counter medications, we need to get approval from the practice leader or on-call officer. Okay. Then in the case notes, we need to chart the reason for the PRN, whether it's worked, was it effective, or do they need to be prescribed something else? What we gave, when we gave it, and whether it was and what dose we gave.
And I have
yes.
a question.
Sure.
Like we have a customer. If she has a two seizure, then we need to give her clozapine.
Mhm.
For example, if she had a second seizure in the middle of the night,
Mhm.
and it's written by doctor in her medication chart, so then still we need to inform our practice leader, like she had most of the time 12:30, 1 o'clock.
At midnight. It's written in her epilepsy management plan, so if she has two seizures within 24 hours, she needs to be administered. So what the staff usually do is they will do the wristband for the first one, they'll do the wristband for the second one.
Mhm.
Basically, somebody was asking like, I don't think so, like, it's needed like 12 o'clock, you're asking them.
No. In that situation, and this is where we all need to communicate so that, and also you need to feel confident in your scope of practice. So yeah, that would be one instance where we wouldn't ring. Okay, but that's a really good question. The other thing with PRN medications, if it's a restrictive practice and a chemical restraint, then you need to do a risk man report and never give it as a first line of treatment. We would always try some behaviour therapy before giving it. Okay. Alrighty. So now we're on to our 7 R's of medication and safe administration of medication. So we have the 7 R's for when we're administering medicines to customers. We need to follow these 7 R's because they provide a standardized procedural decision-making checklist for staff. So basically, the 7 R's, if you follow your 7 R's every time you give a medication, you will not make a mistake. Okay? And I think, Sim, we actually have been finding fewer mistakes now that we've rolled these out and trained everyone up. So what is an example of some of the 7 R's? Don't read them. Yeah, beautiful. So let's go through them. The 7 R's of safe medication administration, the right person. So we need to check the customer's identity, including their name, date of birth, and photo reference. Are we giving the right medication? Also check to see if they have any allergies. You'd be surprised how many doctors write up morphine for customers, even though it's written in red that they're allergic to morphine, for example. So number 2, the right medication and orders. So check the written order, make sure it's current order, make sure either the pharmacy box label or the dose administration aid and the medication order match. Okay. Is the medication still in date? Always check the expiry date. Number 3, the right dose and strength. Check that the instructions on the original packet or the dose administration aid matches the medication orders. That is same strength on both. So you need the same strength on the medication chart and the same strength on the box or the dose administration aid. Check what you have prepared and make sure it's correct. And also check the decimal points. So I read a risk man once that was talking about a medication and they put the strength as 5 milligrams in the risk man report. Luckily, they wrote it as an error. It's not what was given because they were meant to write 0.5 of a milligram. So that's a pretty hefty overdose. Okay, so always check the decimal points. Number 4, the right time. So check the time of administration on the original packaging, pharmacy label, or the dose administration aid, and check that they match. So you don't want to be giving the 8 o'clock medication in 0800 medication at 2000. A really good way to make sure that doesn't happen is whenever you go to give a medication, say, "Hi, Sim, I've got your morning medication. Are you happy to have it?" So you've checked that Sim's consented and you've checked that you're giving the morning medication. Okay. And if it's lunchtime, they're going to go, "Why am I having it at lunchtime?" And then you go, "Oh, I've got the wrong time medication." Okay. It's a really good habit to get into. When I vaccinate, I always say the name of the vaccination because there are so many vaccinations out there now that it's really easy to get confused. And if I'm coming up to you with a needle and going, "Okay, are you ready to have your flu vaccination?" and you're there for a COVID shot, you're going to go, "Huh? Can someone else give my vaccination, please?" Okay. And also check when the medication was last given. All right. And that is a way we actually had somebody give 2 lots of morning medication. I don't know how you can give 2 sachets for 0800 on Wednesday and on Thursday, but they obviously didn't check So number 5, the right route and method. So check the route. Is it oral, topical, inhaled, intramuscular injection? And also check the individual's instructions about taking their medications, which you've written in here. Okay, that will tell you how they like to have it. The right documentation. So we need to be documenting on the medication chart. Please get into the habit of taking your medication to the customer with the medication chart, so that once you've given the medication and the customer has taken it, you immediately sign for the medication chart. Okay, in the red folder, which I forgot. Oopsie. Okay, so also check if there's any need for any other documentation. So if it's a pain relief that you're giving, for example, you would need to do other documentation, like whether it's had a good effect, whether there were any negative side effects, anything like that. Okay. And lastly, number 7, the right to refuse, which is your consent. Okay, Sim, are you happy to have your medication today? Cool. Good. It'll keep you nice and calm at work. Check with the customer if they consent to taking the medication. As I said, you know, I've got your morning medication. Are you happy to have it? The customer has the right to refuse their medication, and please ask why they're refusing. Okay. Now on to our regular medication orders. I'm not even following my script. Oops. Okay. So our blue page, regular medication orders. This is going to save you lots of time. So these charts have been designed for your multi-pack sachets or blister packs, as well as your your non-packed medications. Okay, so we'll whiz through this because you guys are already doing it. But basically, when you're administering a sachet, all you need to do is sign your name in the pharmacy packed medicine box on the top page. Okay, individually, you need to obviously still sign if something is not packed. You need to sign alongside that you've administered the medication. So we should highlight if it's a non-packed medication. We should also tick that it's non-packed, and no, sorry, we should highlight along the side and put a sticker on it. Okay. And also we need to tick if somebody, for example, is ordered Panadol as a regular medication. So some people may be on it BD and they ask you for Panadol. We also then need to check the PRN order page to make sure that they weren't given it. So there we would tick and highlight refer PRN, so that prompts us to go and check the PRN page. Okie dokie. And once again, please sign immediately that you've given the medication. And if you cannot read the GP's handwriting, please do not give the medication, take it back to them, and it's a legal requirement that you can read their medication order. Okay, luckily now where most of them are using stickers from the pharmacy. Now on this page, this is going to save your GP time, because they no longer have to fill out the purpose of medication form unless it's a restrictive practice.
And make your door every single behavior support practitioner.
Yeah, if it's a restrictive practice, they need to do it.
Even if it's non-restricted.
Okay, well,
or the leads will come to you and go, can you please?
Okay, we'll deal with that in-house, because there's no need, because it's all on here. So please get your GP just to write the purpose of medication, why he has prescribed that medication. So do they have hypertension? Do they have diabetes? Is it for, panic attacks, whatever? Okay. And Sim will remind me, we'll take that up later. Okay, on the back page, we're nearly done with the boring talk. On the back page are your cheat sheets. So it's got your 7 R's of medication administration. Okay, so you can check them. It's got dose frequency or timing, units of measure and concentration. It's got the 24-hour clock, which I'd really prompt everybody to start using, especially in case notes. So the 24-hour clock, once you get used to it, is much better to work with. So if you're giving a medication at 9 o'clock at night, you just add 12. So it turns it into 2100. So if you're giving it at 7 o'clock at night, add 12, 1900. Okay. Sit. This little box doesn't want to sit. All good. Okay. So just in summary, this is a legal document and must be legible. Okay. I can't stress that enough. The medication chart must be stored in the red folder. And the only other thing I want in the red folder is the consumer medicines information for each of the medications that they're on. When the medication is to manage behaviours, it is considered a restrictive practice, and the restrictive practice organisational procedure must be followed, as well as their behaviour support plan. If a PRN medication is to be taken on a regular basis, it may require a review by the GP just to see if it should be written up as a regular medication rather than PRN. And the PRN medication must be signed for in the PRN medication green chart with the date, time, quantity, and signature. See, it just, Maria's bounced back in, but see, it just moves me. Just whenever it feels
Hi,
like it.
sorry, I lost connection.
That's okay. Welcome back. So, and don't forget we're charting them across the page, left to right. It's not just me, is it? It does just do what it feels like. Okay, so the case note for a PRN medication must include the alternative interventions that we tried before resorting to the medication. Even if somebody has a headache, you might want to offer them a cold flannel and a dark room or something before resorting to Panadol. The reason for the medication, the date and time of the administration, the medication name and strength, and the effect. Did it work? Because if it didn't work, we need to change it, okay, and get something else done. Okay, so now I'm going to get each of you to read out a scenario for me. And I'm going to show you how we document it in the medication chart. So, who wants to go first?
Sorry, I actually have to go because I start at 10. So is that okay?
That's fine, Maria. Yeah, not a problem. All good.
Yeah.
Thank you for attending.
Thank you so much for the time that you spent doing it.
Thanks, Maria, and have a good shift.
You too. Thank you. Bye.
Thank you. Bye. Bye. Okay, so
Robert is needing his immediate medication to be administered for the 21st March 2025.
okay, so we would turn to the regular medication chart.
Yeah.
Is he? Yes. Okay. And you said for the 21st of March?
Yeah.
So this is in a sachet. So we would follow along from the 12 o'clock time zone.
Yeah.
We would find our March page. We would, so follow along from the 12 o'clock to the 21st and initial in the box. Okay,
Yeah.
so there's my 12 o'clock medication.
Yeah.
And I've checked the month and the year, and I've done my 7 hours. Okay?
Yeah.
Next.
Sam need to have his 8 o'clock dose of amoxicillin of 500 mg on the 22nd of March.
Okay, so I'm hearing that Sam has a short-term medication order. And that is obvious to us because of our paperclip. Please, 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 whenever we have a short-term medication order, use this paperclip. Because
we need it for Peglo, I'm pretty sure.
Yeah, you
We just need it for Peglo.
check your handbag. I'm sure I gave everybody enough.
We've just started doing Peglo.
No, okay. So this is a very high rated medication error. People come on, go to give the medication, and they haven't realized that there's a short-term medication order. This is why we use the green paperclip. Okay. So please, please, please use it. So I'm checking the administration of amoxicillin. I'm going through my 7 Rs, 500 milligrams, and I need to give the 0800 dose on the 22nd of March. Is that correct?
Yeah.
Yes.
Beautiful. Okay, so I'm just initialing there on the 22nd of March. Okay, beautiful. Next.
Tom has a complaint that he is experiencing a headache and he is requesting some Panadol.
Okay, Tom needs some Panadol.
Yeah.
Okay, so that correct. We go to our PRN page where we have Panamax ordered and we check the last dose and he hasn't ever had any before. I'll just quickly double check that he's not had any Panamax on his regular order. No, all good there. I'll do my 7 Rs and I will sign, I will date. So today's 23rd. Did that have the date on? No, 23rd of July. I don't have to put the year because it's on the top of the page. Okay. I'll put the time that we're giving it is 10 o'clock. And quantity is 2. And then I'll initial. Okay. So that's how we do it. And our next dose is here. So we're working across the page. Okay. Really easy to see. Okay. So very good. So I know how to use the medication chart. Now I've got some scenarios for you guys to do your medication charts. You want one, Tim? So we have Alex has come to us as she is experiencing pain in her lower back. She is asking if she can have some Nurofen to help with the pain. So please sign on your medication chart where you would be giving that.
Yeah, yeah.
Have a look. Yes. So it's more than likely going to be PRN because it's relating to pain. Okay. So you need to sign that you are giving her medication on the 23rd of July at 10 o'clock. Oh, do you need pencils?
Yeah.
Oh, dude. Rather over here. Thank you. Oh, good catch, Sim. Excellent. Okay, so it's signing that you're giving me Nurofen on the 23rd of July at 10 o'clock. And
10 o'clock.
yep, very good. Is that what the order says?
Yeah.
Very good.
Sure, I've initiated the page. So that
Good pickup.
who I am.
So that is what, oh, okay, no problems, that's fine. So Sim has just realised that she hasn't signed the staff sample signature page. Very good. Okay. So now Alex would also like you to rub some Voltaren cream into her lower back that has been prescribed as a regular medication 3 times a day.
Has it already been administered in the morning? If it has been, then we'll need to wait for the time.
Very good,
Yeah.
but it hasn't been yet administered.
Yeah.
Now, what's wrong with that medication order?
Is it written down?
What's it missing? Is it in a sachet?
No, it needs to be there.
Uh-huh. So we need to highlight it and stick a sticky label on it.
Yep, so this needs to be highlighted if it's not highlighted.
And I forgot to bring us a highlighter up, but we would do that and we would highlight there. Okay, because that is alerting us to the fact that we need to sign for it alongside the order. Correct? Beautiful.
So we go with the morning one, it's not mentioned any time.
Yeah, so we can go the 20, yeah, so we're going to do the 0800 on the 23rd of March.
Doesn't say, oh, so we are assuming it's 23rd today.
That's what we're making it up as we go along, this thing. Oops. 23rd of March.
8 a.m.
So you follow your pen along from 0800 until you get to the 23rd of March. It's like going back to school with the graph paper, isn't it? Okay. Beautiful. Okay, Alex is needing her 0800 medication to be administered to him. Oh, he's changed sex on the 25th of March, 2025. So 0800 medication on the 25th of March. Perfect. You guys have got this. Okay. Alex has just gone to see the GP who has started her on a short course of antibiotics for a toenail infection. You have collected the medication, and this is how I want to play it. If you take a customer to the GP and they are ordered a medication, you then go straight to the pharmacy with the medication chart and the script if it's if the GP gives it to you, or it may be sent straight to the pharmacy. So you go straight to the pharmacy, and so you get the medication yourself and you're ready to start that medication straight away when you get home. So you will need to set up the medication chart for this antibiotic. So where would we turn to first? Perfect. Short-term medication. Okay.
Reaching is on, ranging is
The
on.
paper clip is on. Perfect. And I want, the doctor has ordered clindamycin 150 milligrams 3 times a day. No, 3 tablets 3 times a day for a toe infection. Okay. So the GP may or may not write the times in.
Yep.
Okay. So TDS, we can double check on our little cheat sheet back here, means 3 times a day. So officially that's 8 hourly, but you wouldn't want to be giving a patient a medication in the middle of the night if it's an antibiotic.
Yeah.
So routinely you would give it at 8 to an 8, or maybe 8 to and 10, something like
The
that.
options, because some of the day options don't make a big fuss on
Yeah,
administration during the day.
sure. And we have to work around that. Okay, so you need to write your times in, and you need to administer the first dose of medication, and you'll need to also write something else in along the top.
Times.
So you'll need to chart the dates and the times. Now, a good way to write the date is 23 is on its side. So you can actually write the date like that on its side, because it just fits better. Okay. Perfect.
So 8 to 8,
Sorry.
3 times a day, 8 in the morning and
14 and then
20.
Yeah. So 1400 and 2000
it's for 3 days, isn't it?
for 5 days.
Fine.
So your end date will be the 28th.
Yeah.
There's the first one, yes.
Perfect.
So we are assuming it's 8 o'clock in the morning.
Just one thing, like if you missed the morning one, if the rush,
Sure. Perfect.
so we can start mid of the day.
Absolutely, because your appointment at the GP was 10 o'clock. So by the time you got to the pharmacy, it was 11 o'clock. So you are going to be giving their 2 o'clock dose as their first dose. Yeah, so that is what we would do. And if you want, you can just put a little cross in the 0800 box, because it wasn't administered. It wasn't started
Okay,
yet.
so we can put a cross.
But I administered already.
That's okay. You went to the doctor early.
Yesterday went to start protocol.
Okay.
Absolutely. There, for example, if you go to the GP at 4 o'clock. Write the cell at 9, but on that morning for 8 o'clock and 2 o'clock, just stop it off and then you can start it the next day from 8 o'clock.
Perfect. Good job, guys. Excellent. So, this is pretty well it. Just a couple of questions. Where would we stick the drug alert label? Yep, on the front page and somewhere else.
Under the
Yep. There's another page we put it on. Short term,
Yep.
because the GP is going to be writing a medication and he needs to go, oh, I need to check the allergies. Good job. We've pretty well gone through customer what they do with they refuse a medication. I think you're all up with that. When do we use our 7 hours?
every time we give a medication.
Excellent. Excellent. Good job. Now, just we're nearly finished, so just bear with me. So are you feeling happy and confident and empowered to actually be happy to handle this medication chart out in the field? Good job. I am too. So please don't forget the the more checks we do, the less errors we have. So that really the only time we are getting errors is because we're not checking enough. And that is why when the medicines come in from pharmacy, we check. When they are about to be administered, we check. When we're about to give them, we check, because the pharmacy may have made a mistake. The pharmacy takes a photo of every single sachet that is packed. So if there's a mistake in the sachets, they just pull the photo associated with that sachet and they can check. Okay. So when the charts have 2 weeks left, collect a new one from me, which Sim has just done. Complete the front page and feel confident. I'm always here to phone if you have any queries, because I know it's different when you go out onto the field and you go, oh, what did she say? Then once you've completed the front page, take it to the pharmacy to get the stickers put on, and then to the GP so that the GP can check the stickers and sign the medication order. Okay.
Yep.
Perfect. Thank you so much for your attention today and your attention to providing our customers with 100% accuracy in medication delivery. And that's what we're aiming for.
Thank you.
Okay, perfect. Beautiful. Now, I will just stop our recording and breathe.